Okay, thank you, everybody. Appreciate you taking the time today to attend our webinar, Best Practices Using the Levo System within the VA. My name is Matt Lopez. I'm the Regional Sales Director for Levo Medical. And today I'm honored to introduce our panelists today, Dr. Amber Kasten, Clinical Audiologist and Vestibular Program Manager for the Tiber Rubin VA Medical Center in Long Beach, California. Dr. Kasten has been with the VA for over 5 years, taking on many leadership roles, including leading the tinnitus program at our site since 2019. Dr. Kasten has many years of experience in incorporating Levo within their PTM program. Excited to have her share some of that experience with you all today. Unfortunately, our second panelist, Dr. Casya Hickman, is out sick today and won't be able to attend our webinar. Dr. Hickman is also an audiologist at the Tiber Rubin VA, along with Dr. Kasten. We definitely wish her a speedy recovery here. Also joining us today, Dr. Daniel Drexler, our clinical director with Levo Medical, as well as one of the original founders of the Levo system. Dr. Drexler currently runs a multidisciplinary tinnitus clinic in Montevideo, Uruguay, where he's successfully utilized the Levo system within his tinnitus patient population. So thank you both to Amber and to Daniel for joining us today. Before we bring them both into the conversation, I first would like to provide a very brief overview of the Levo system so we're all on the same page. So the Levo system, as a review, is customized sound therapy for patients to listen to at night while sleeping. It's intended to facilitate neuroplastic mediated changes to both decrease the intensity of a patient's perception, as well as to desensitize their reaction to their symptoms. The system consisted of 3 parts. The manager device is what the audiologist provides. This is the programming device that's on an iPad, where you're able to create and track a patient's therapy over time. Patients receive the patient device, which is on an iPod Touch, along with the high fidelity earbuds, specifically designed for the type of sound, no bass, clarity of the sound as well. Patients do have control of setting the volume each night before going to bed, and they're instructed to set that volume just above their tinnitus perception each night. The programming device allows you to create a replication of your patient's tinnitus in terms of the type of sound, the pitch, the volume. You do have the option to mix and match various different types of sounds. 3 are tonal, the pure tone, the cricket, and the modulated tone, as well as 2 atonal sounds, the white noise and the band noise. So you can mix and match at various frequencies, intensities for your patient to customize and to get as close of a replication to your patient's perception as possible. And then throughout the course of the therapy, the Levo system does provide some data logging, which is downloaded when the patients return for a follow-up visit. What you see here is the usage data, how and when a patient is utilizing the sound therapy, as well as a volume evolution report, so how loud the patient is listening to their therapy. Again, patients are instructed to set the volume slightly above their intensity each night, meaning a downward trend in the graph correlates to their own perception decreasing in intensity. So just a quick overview there, but now I'd like to reintroduce Dr. Amber Kasten into the conversation. And again, thank you, Amber, for joining us today.
Hi. So I'm going to be talking just a little bit about how we incorporate this into our progressive tinnitus management program. So the way that we funnel patients into our PTM classes is through their audio eval. So all of our providers are sending those patients into that tinnitus class. Right now, we are doing in-person sessions. We're also going to add a telehealth version. So we're going to have in-person sessions 1 and 2 at the beginning of the month, and telehealth versions over VVC on the 3rd and 4th week of the month, and then send all of those patients to the cognitive behavioral therapist for sessions 3 and 4 on the next month. But in session 1, we're typically going over what tinnitus is, what it isn't, the causes, how habituation works, why you would use different types of sound, the soothing sound, the background sound, the interesting sound, how they can be incorporated for different types of tinnitus problem situations, how to use that sound plan worksheet. And then in session 2, after they've, tried their sound plan worksheet for a week, we talk about different ways they can adjust the types of sound they've chosen, what worked well for them, what didn't work well for them. And then we introduce different items the VA can provide for them to help them use those sounds that they identified the week before. And one of those things is the Levo system. So we talk about different pillow speakers they can use. We talk about different Bluetooth speakers they can use. We have a headband that they can wear. But then one of those items then is that Levo system. And we introduced the idea of it. You're going to listen to this sound that we're going to try to match to your tinnitus, and you are going to have to listen to it every night, all night for a few months at least, most likely up to about 9. So we lay that groundwork for the expectations. And then we give them a little bit of a pros and cons list to all of the items that we have to offer. And then we leave that up to them if they feel like that's something they would like to try, because motivation is really important with this. So we really like to leave that in their, in their court to make sure that, they actually are very motivated to move forward. There's a list of, different things that make them a good candidate or not, and we present that to them so that they know, might this be something that would work for me, or am I kind of off to the side? This is not, going to be what I want. And when we first started doing this, we weren't necessarily as discerning, and we were not getting as good of results as we would like. But as we've gotten more used to it and gotten more comfortable with the candidacy criteria, we've gotten better and better at identifying the right patient and have gotten much better outcomes. And we've had a lot of really happy people.
Excellent. Thank you, Amber. You touched on patient candidacy as a huge indication of what patients succeed or not and move forward with Levo. Can you just go into a little more detail on who you think is a good candidate and how you differentiate one versus the other?
Yeah, so as I'm sure you're aware, when you go into these PTM classes, these patients have a lot of comorbidities. A lot of them have anxiety, depression, PTSD. They've got a lot of stuff going on. A lot of times we're seeing patients that have been through a TBI, have other cognitive impairments of some type. So it's really important that we talk to them about these things that maybe we don't know yet. That is really something that they haven't shared with us yet, but is still important. The things that we do know and have control over before we even see them are they a good audiological candidate? Do they have, hearing that is within the range of the device? Do they have middle ear disease? Do they have tinnitus for a long time, or is this newly onset? Is it fluctuating, or is it pretty stable? How old is the patient? That's obviously something that we know. And if you do a little bit of a chart review beforehand, some people have time for that, some people don't, but you can look and see if they have, cognitive issues, or if they're if there's someone who does struggle with depression, anxiety, PTSD, those types of hyper vigilant types of diagnoses. But I think that so far our biggest predictor of success has been motivation.
Motivation of the patient and making sure that they understand the expectations and they're willing to listen to the therapy nightly.
Yeah,
that it's
for sure.
Biology is slow, that it takes time to see the success, right?
Yeah.
Yeah.
So we've had people that are, on the older side, like 70, 80, and have had tinnitus for decades and still had, benefit from it. So I've really come down to it's the mindset that really is the biggest predictor for us.
Excellent. That's helpful. And if you don't mind sharing, you've had years of experience with Levo, and there's been pros and cons with various patients. What are some of the benefits that you've seen with successful outcomes that Levo brings to your tinnitus patients?
So some of the best patients we've had are patients who have tried a lot of things and nothing's really been helpful for them. So these are people that we've gotten the Bluetooth speakers for. These are people that we've had through the PTM class before, or they have been working with me on fine-tuning a sound plan, and it's just not, what they need. So what they're looking for a lot of times is a cure, and I don't have a cure for them, unfortunately, but the closest thing I can do is offer a little bit of hope that they might get some reduction in the intensity of their tinnitus from something like this. And that little bit of hope can make that motivation so much bigger and so much more on the forefront of their ideas on how to tackle their tinnitus. Like, if I put in the work for this, it could help, and there's a chance that it could get less. So I think that's our biggest our biggest way to address the motivation factor, if that's something that someone has been really struggling with.
Excellent. Thank you for sharing. At this time, we're going to take a quick pause with Amber. We're going to come back to you for a couple of case studies. But now I'd like to introduce Dr. Daniel Drexler, who's going to touch on a little bit of the science behind the Levo system. Dr. Drexler, thank you.
Thank you very much, Matt. Well, I want to talk about the advantages of the Levo system, and we can divide them in two groups. The first group are those related to the type of acoustic stimulation that we use, and the second one are those related to the fact that the stimulation is performed during sleep. So let's go first through those advantages that are related to the type of acoustic stimulation. Next slide, please. Regarding the type of acoustic simulation, Levo allows to design what we call the individualized acoustic receipt, which is a highly customized sound that reproduces the frequency and intensity characteristics of the patient's tinnitus. Each tinnitus is unique, as if it was a kind of acoustic fingerprint. Levo allows to combine 5 different types of sounds and adjust the variables of each one of them in order to be able to reproduce each patient's acoustic fingerprint. The therapist can replicate the patient's tinnitus by combining pure tones, white noise, bad noise, cricket sound, and modulated tones. On each type of sound, frequency components and intensity can be easily and precisely set. Also, Levo has a very stable response between 100 Hertz and 16 kilohertz. So you can cover almost all the frequency range of a human being, of an adult human being. The data of intensity of each night stimulation is stored by Levo, allowing to create the volume evolution graph, which is an extremely useful tool to monitor the evolution of treatment and generate psychological reinforcement for the patients. Because the patients, as he goes through the therapy, he starts to notice the changes, and he can even compare how is he at at certain moment of the therapy and how he was at the beginning. What we usually do is to cross the data from the scores of the psychological test from the TFI and the data from the evolution graph of intensity. And this helps us a lot to take decisions in relation to the evolution of the patient. Levo delivers high precisely acoustic patterns that are fundamental to produce a more efficient induction of neuroplastic changes in the auditory system. In recent years, we have learned that the best results with acoustic simulation are achieved when sound stimulation includes some of the spectral and/or intensity characteristics of the tinnitus. This was studied by Skyte in a study from 2010. We have also learned that incorporating tinnitus pitch and/or range of hearing loss is effective in reversing tinnitus-related neural hyperactivity. This was stated in a classic study by Noreña and Edermont. So let me insist once more on the importance of the precision of the acoustic patterns in the generation of changes mediated by neuroplasticity. Next slide, please. Other advantages of Levo are that the treatment is done during sleep. Why during sleep? Well, all sensory systems continue to process information during sleep. All levels of the auditory pathway remain active while we sleep. Also, during sleep, the stimulus provided by Levo has less competition with other sensory inputs. The therapy during sleep does not compete with other day-to-day activities. This allows a stimulation window of up to 8 hours. This is very important also. The patients are unaware of the stimulation while sleeping, which reduces anxiety related to the therapy. Levo therapy improves the quality of sleep. Data from a clinical trial that we published in 2016 in the International Journal of Audiology shows a very significant improvement in the sleep subscale of the TFI from a pre-therapy average of 68 points to a post-therapy average of 13 points. There is a close relationship between sleep and tinnitus. If the quality of sleep worsens, the tinnitus worsens, generating a vicious cycle that in turn worsens sleep. The improvement in sleep quality observed with Levo tends to transform that vicious cycle into a virtuous one. All of us who treat patients with tinnitus know that in most cases, the worst moment for our patients is before going to sleep, since the decrease in noise from the environment puts tinnitus in the foreground. The fact that Levo therapy starts before going to sleep gives patients a tool to help them navigate this very challenging moment of the day. Next one. This is a study from 2017 by Theodorov et al. From Dr. Henry's group at the NCRIR in Portland, in which 60 patients were divided in 3 groups. The first group was treated with the bedside sound generator. The second group with Levo system, but with non-customized sound of the patient choice, like sea noise, wind noise, white noise. And the third group was treated with Levo system with the individualized acoustic receipt, that is, a customized pitch match sound. The results of the numeric rating scale for tinnitus showed that the group treated with the customized sound obtained better results in relation to the reduction of tinnitus loudness. In turn, this protocol demonstrated that the best results were not only achieved by applying the treatment during sleep, but that the precision of the customized sound made the difference, because there was also a difference between those patients that used the Levo system with a non-customized sound and those who used the Levo system with the acoustic receipt. And of course, the results were better in those that used the acoustic receipt that we designed. The numeric rating scale, which goes from no tinnitus to very loud tinnitus, showed 95% certainty that the customized sound generated greater reduction in subjective ratings of tinnitus loudness. Also, results predict a 91% probability of improvement in quality of life measures with Levo system therapy. Next one, please. This is a preview of the results of an analysis that we are currently doing on 60 patients from the Montevideo Tinnitus Center database treated with Levo between 2015 and 2022 that uses they used the system for 9 months. 85% of them showed some degree of tinnitus intensity reduction, with 27 achieving a reduction between 1 and 5 dBs, 32% between 5 to 10 dBs, and 25% greater than 10 dBs drop. And let's remember that a decrease of 6 dBs halves the pressure of the sound, and a decrease of 10 dBs halves the perception of the sound. So those figures are correlated with a strong improvement in the quality of life of the patients. I mean, our patients don't stop, usually they don't stop hearing the tinnitus, but they say that the tinnitus is not longer all the time in the foreground. Some of them say that the tinnitus goes to the back of the head, or that they don't even hear it during the day, and they only hear it during the night. But since the tinnitus is not so detached from the noise floor that is in the surrounding environment, they don't have big problems getting the focus of attention out of the tinnitus. So these results seem to show that the best treatment outcomes are achieved with a 9-month period of use of the system. So next slide, please. Those results led us to propose a 9-month therapy preceded by a variable adaptation phase that normally lasts between 2 weeks and a month and a half, depending on each patient characteristics. I mean, we are dealing with human beings. Human beings tend to be complex. So in each case, there are patients that they adapt to the system in 1 week or 2 weeks. There are patients, most of them, they adapt between 1 week and 1 month. And there are patients that need more time to learn how to use the device, learn how to use the earbuds, learn how to sleep with it, how to adjust the volume every night before going to sleep. Well, all this is done during the adaptation phase. Then there is a phase of continuous stimulation in which the patient stimulates every night between 3 and 5 months. This is the phase in which we usually see the intensity reduction. And this is the phase in which the patient starts to feel an improvement using the device. And then there's a detachment phase until completing 9 months of therapy. At this stage, we gradually reduce the number of stimulation nights with the aim that after finishing the therapy, the patient only uses Levo against punctual decompensations. I mean, the usual story of our patients is after they finish the 9 months of therapy, they just use the device when, for example, they go to a party, and after the party, they feel that the tinnitus is again up. But the good notice is that when they start using the system again, they don't need to use it for 9 months. Just using it for 3 or 4 days gets the tinnitus again to the level that was reached after the therapy. So now I'm going to ask Amber again to get in and to show a case study. Amber, please.
So this is a patient that I am still seeing right now. I'm actually seeing him today, but he is on the older side. He's 74. He actually has a pretty extensive history of anxiety, PTSD, depression, but he is active in therapy. So, and he reports that his therapy is improving his sleep, improving his anxiety, improving his PTSD. So even though those are kind of counterintuitive and kind of put someone in that not a great candidate category, we still considered him because he had a lot of motivation and he was, going to therapy and seeing improvements from that. So that's another factor. Maybe somebody's not a great candidate, but if they're willing to work on the things that are making them not a great candidate, I'm still willing to try it with them. So We started with him back in April for a hearing test, and he has a long-standing history of some high frequency hearing loss. He's got a mild to moderate sensory neural hearing loss on both sides that's been stable since 2019. He's got pretty good word rec. He's got, 85-ish% in the right ear, 100% in the left ear. He had normal tympanometry, so his middle ear is good. He says that his tinnitus isn't causing him trouble sleeping, but it's gotten much worse over the past several months. So it's not new onset, but it's newly bothersome to him. So maybe he's not a great candidate based on how long he's had his tinnitus, but it wasn't bothersome before and now it is. So that part is kind of new onset. So I thought, let's just try it and see how it goes. So he got his hearing aids optimized in May after his eval. So we for him to use during the daytime, we loaded his new hearing test, reran his real ear, gave him a tinnitus masking program, and we also dispensed him a tabletop masker at that time. So we gave him some stuff to use during the daytime that wasn't the Levo, and then he went into progressive tinnitus management classes at that point, where his THI was at 76, which is severe, and he is saying he's almost always hearing it. It's not hardly ever, masked by anything. He reported his most bothersome tinnitus situation was concentrating throughout the day. So that's why we gave him all of those daily use types of things like hearing aids and the Bluetooth speaker to use during the daytime. He wasn't currently trying anything to manage his tinnitus when he went into PTM. So the onboard tinnitus masker, the Bluetooth speaker, the sound plan worksheets, all of these things were new to him to try. We discussed the typical PTM topics, like why tinnitus is more bothersome to some people versus others, which he equated to his hypervigilance diagnoses, things like depression, anxiety, PTSD. In session 2, when we introduced the Levo, he was very interested. He wanted to try it very much. He had a high level of motivation. So we went ahead and ordered that for him, and we fit him at the end of June. At the time of the fitting, his TFI was 30.4, which is on the small problem side. So he'd had a little while to use his, other things that we'd given him, and he had a little bit of improvement from that as well. For him, initially, he chose crickets as his sound. We got the volume set for him. It was the same on both sides. He picked, his pitch, and he didn't want to add any extra sounds to it. A week later, we call them to see how they're doing, make sure they're able to use that every night. They're not having any hiccups. The sound hasn't, actually been something that they can't use. Just a quick checkup. So this is about 5 minutes, and he was reporting that he was using it consistently, not having any issues. Then a month after that, we did his first follow-up in person. So at the end of July, he said he was reporting that he used his device every night, not having any issues, but that some days the volume seemed too loud, and he has to turn it down. He wasn't doing it every day, but some days he didn't need to turn it down. He liked the volume to stay where it was so that he could turn it down himself, so we didn't change that. And he liked the pitch of it, but he said that his tinnitus was different now, and he wanted to change the sound of his tinnitus from crickets to the pure tone. So we did that, and he reported that it sounded just like his tinnitus, and that he wanted to keep it like that. So that's how we sent him out that day. But he reported that over the past month, while he'd been using it, his sleep had been improved. and he was falling asleep much easier. Even though he hadn't reported that as his bothersome tinnitus situation before, he was noticing that he was getting some benefit in that arena. At that first follow-up, we did another TFI for him. We do one at every follow-up, and it was at 3.2, which is very firmly in the not a problem category. So he had a 27.2 point reduction in TFI after just 1 month. And this is something that he had been experiencing for years and years and years. So even though he wasn't a perfect candidate, on paper, that motivation, the fact that he was putting in the hours with his therapist and he was working on the things that weren't necessarily making him a great candidate, he was, excelling with this Levo. And he literally said to me, "You don't know how much you've done for me with this." And, those types of reports are what get me coming back, because when something makes that big of a difference to a patient, then I know that it's not just a fluke. There has to be something behind it that makes this work well for people. So, that in itself is something that gets me excited to continue to fit this for other people. And then this is Casya's patient. So I didn't actually see this patient, but she did. So I'll talk to you a little bit about it. But this patient is much younger. He's in his 20s. He's had a lot of noise exposure. He's never used a hearing aid. I don't think he has any hearing loss. No, his hearing is normal on both sides. He's got great word rec, about 100% on both sides at normal conversation level. He's got a normal quicksin, and no issues with his temps. Everything in the middle ear is looking good. He does have depression though. So that is one of those things that can give us a little bit of pause that they might not be a great candidate. But his tinnitus is pretty newly onset. He said it was about 2 to 4 years ago. So we said, let's go ahead and try it. So he went through PTM as well, same as the other patient. We got him some custom hearing aids to use during the day. We like to do a little bit of an occluded fit for patients with tinnitus to give them a little bit more boost to the environment. It doesn't have to be, fully occluded. I typically will try to go with like a Rick style device with a closed dome or maybe a tulip dome. So she chose to go with a Resound custom hearing aid for this patient. And she is big on using apps for sound-based therapy throughout the day. So that was her choice. She did give him a large vent on that custom device to help with the occlusion, but we do still want to try and get a little bit more sound in there. But at his fitting, he had a TFI of 58. He picked his sound, his volume, and he also did not choose to do multiple sounds on his device. You can, but I haven't had many people want to do that. I've had maybe a couple here and there, but most people just choose one sound, and they run with that. He was told to wear his devices every night, and that he would need to be consistent with it to make sure that habituation happens over time. She does a 2-week phone call follow-up with them. And he reported that his devices were amazing. He said that he had an improved ability to sleep. He had a reduction in how much he was bothered by his tinnitus. No reports of anything negative going on from using that Levo. His consistency, he reported as 8 out of 10. So he wasn't wearing them every night, but most nights. And then at his 1 month follow-up, he said everything's working well and he wants to cancel his future appointments because he has no concerns at this point. So he was doing really great after not very much time as well. So totally different patients, totally different. This guy's very young. He's got, normal hearing. He hasn't had tinnitus for very long. And he had, just as much benefit as the other person. We didn't get a TFI for him because he called us before his follow-up and said he didn't need anything anymore. So we don't know what his final TFI was for him, but he was doing so well, he didn't want any more intervention, which, if you recall, that's one of the main goals of PTM is for the patients to be at a point where they feel like they no longer want or need intervention from us. So we call that a success at that point too. I wish we had the data, but success is success.
Amber, I totally agree with you that motivation is the leading thing in order to get a good therapy process with a patient, because of course we have better results. You have usually have better results with patients that are young, that they don't have hearing loss, or that they have a mild hearing loss and they have a recent onset of the tinnitus. Those are the best ones. For example, a patient that is in his 20s and he went through an acoustic trauma, and those are the best ones for us. But we usually see here in Montevideo with our patients, we already have 700 patients treated with the system, that there are many cases in which we are surprised by patients that are very old and they have a long onset of the tinnitus, and they also use hearing aids, and they have a moderate hearing loss. But anyway, if they have the motivation, if they have I don't know if you use the word resilience in English, but it's, the possibility of getting through problems in life, those patients are the ones that for sure, even if they are not the best candidates, they can do well. Another thing that I heard from what you were saying is the change of the sound from the beginning, from a cricket to a pure tone. We see that a lot. Also change from, for example, from a band noise to the central frequency of the band noise. This usually happens with the system, and it's a good sign. I mean, those patients that did this kind of getting from a sound that is bigger to a smaller sound that is more focused on one pure tone, those are also the patients that usually do better with the system. So thank you very much for your case studies. It was really nice for me to hear them here from Uruguay, seeing that patients do in the same way also in the States than what we have been seeing here for the last 20 years.
Thank you, Daniel. Thank you, Amber, again for sharing the case studies. Just to bring you back up, Amber, a couple of questions. You mentioned protocol for your new onset patients. Do you mind just reviewing what your typical process is for starting a Levo, your follow-up appointments, and going forward with that?
Yeah, so typically we start them at an audio eval. Everyone who goes into PTM has to have an eval before they go in. So that's the starting point. And then they come into progressive tinnitus management with me. And we, go through that with them. This is one of the ideas that we give them as something we can offer. If they're interested, then I typically will schedule them for a 30-minute appointment to, talk with them more in depth about the things we've already talked about, their motivation, their, contraindicators, things that they might have to overcome, the expectations they have. And if they're still interested, we'll order it for them. And then based on our schedule, mostly we see them about a month later for their fitting. We do that TFI there, the initial TFI, pick out their sound and introduce, all the expectations. We want you to set it a little bit lower than your tinnitus, and we want you to check this every night. We want you to adjust it as needed. Please make adjustments. A lot of these patients are used to, set it and forget it with their hearing aids. And so we have to really reiterate to them that please, make an assessment every night of whether you want to turn this down or not, so that they're continuing to lower that sound quality, or not quality, sound volume for them. And then I do 1 week, Cash does 2 weeks. We do a phone call with them. It's about 5 minutes, just to make sure they're not having any issues with the sound, not having any issues with the earbuds, are able to, use it every night. We're toying with the idea of coming up with with an Annie text message for them to remind them to use it. So it's something we've implemented with our hearing aid patients to remind them to use their hearing aids via text message. So we're looking at adding an Annie for these tinnitus patients as well. But and that would be throughout their whole, 9-month, journey, not just the first week or two. But after that first phone call, we do a follow-up at 1 month post-fitting, where we do another TFI, adjust the sound quality if we need to, adjust the pitch if we need to, adjust the volume if we need to. And then just remind them, I want you to keep wearing it every night. I want you to continue to assess whether you want to turn it up or down. And then have them come back at 3 months. So at that 3-month appointment, we're going to do another TFI, take the data off of their device again, make sure that we're seeing them, reducing sound over time, hopefully, and assess where they're at. For this patient that we're seeing today, assuming he, is still happy with it, we're probably going to start trying to wean him off today. So we're going to have him start to lower that volume over the next, weeks to months, whatever he needs it to be.
Excellent. Thank you. So if you can remember back when you first started with Levo and the onboarding process, there's a lot of VA sites here with the question on how did you get started? What was the approval process like? What type of information you provided to prosthetics? Any tips that you could share with those individuals?
Yeah, so it was kind of a long process. And every VA is different, so it's hard to say, do the exact same thing I did. But what I asked you for, examples of what other VAs had done, so that I could present that to, our leadership and figure out how we can, make that happen for us and our version of whatever it is that they were doing. I would say it probably took, 3 or 4 months to get it all set, and then once we got it on contract, our first order comes with the iPad. And I had you come in for probably the first, 2 or 3 patients to make sure I was doing everything right. But once you've done it, once or twice, you're like, oh, this is extremely easy. I just need to remember, where things are in the app, and the more you do it, the easier that comes.
Excellent. Yeah. Thank you for sharing. And you are right. Every VA is different. Some prosthetics departments require different information than others. So happy to assist anyone during that process. And please just reach out to us to see what we can do to help with that process. I am going to, before we open it up to some Q&A for both Amber and Daniel, let me share additional slide here on something new with Levo, called My Levo, and My Levo is an online learning platform which provides 24/7 access to patients for instructions, additional training that's needed to help enhance their results from the Levo system. It consists of various self-driven learning modules, helps the patient develop fundamental skills on managing their symptoms through attention training, stress management, building good habits. And so currently there's 10 different modules that's available to you and your patients. And we do expect to launch another 10 here within the next couple of weeks. This is an example of one of them at a glance on desensitization. Helpful hints, helpful hints on voluntarily shifting that focus away from their tinnitus. And so about 2 to 3 minutes in length for each of the modules that they can access just through the website, and then view on their patient device as well. So I know, Amber, you've had a chance to review some of these modules in the past, and I know you've talked quite a bit about your PTM program and the importance of providing desensitization training to your therapy patients. Can you just talk a little bit more about your experience and the importance of adding this as a tool to your tinnitus patients?
Yeah, so what I really liked about my Levo is that a lot of it is the exact same stuff that we are teaching them in PTM, that we're telling them as they are going through their fitting and follow-up procedures. So none of it's like new information to that patient. All of it is stuff that we've already told them. But as you only retain so much information. So I think it's really great to get these little bite-sized bits of information, a little bit here and there, helps them retain it, have another form factor, getting it in those smaller doses so that they can, retain that information a little bit better. I also love the calm nature of the audio guides. Like, we're asking them to work on mindfulness and relaxation and calming techniques in PTM, and I also recommend that for every patient that we have fit with a Levo. But I also do, vestibular rehab, and we ask them to do it for that too. I've had a lot more feedback from those patients. They're a little more forthcoming with me, but when I ask them to show me what they're doing, they will typically show that they do it for like 45 seconds or a minute. And that's just not enough. So I love that they're about 5 to 7 minutes. It's not long, but it's long enough to have an effect. So I really like the incorporation of that.
Thanks. Thank you, Doctor. Daniel, anything to add on my Levo or desensitization therapy?
We are really excited with my Levo because we know when we work with patients that there are a lot of information that we have to give to provide to the patients. And many times, once the patient gets out of the office, he forgets a lot of things. So he has this material that can help him to get again into the information. Also, the audios that we provide that help the patient make a fixed training during the therapy. Also, inside my Levo, we have a guide on how to use the system, which is very useful because it helps the patient when he's at home before going to sleep. If he has any doubt about how setting the volume, for example, there's a special content about how setting the volume. There's a special content on how using the app in the iPod. And also, what we have learned in the last years is the best results are always achieved with acoustic simulation when you combine acoustic simulation with counseling. And if we have the possibility of having both of them inside the same system, and we have a counseling system that is related to the therapy, related to the different phases of the therapy, it helps the patient to go through the therapy in a more precise way. So now what we think that we are doing here is we are making two simultaneous and synergistic learning processes. One is a neuroplastic mediated change that significantly decreases the intensity of tinnitus through acoustic simulation. And the second one is what Levo provides, is a course for desensitization to tinnitus response. And of course, the best results are obtained when we combine both of them. Because, for example, if the tinnitus is a strong line in front of your eyes, it's going to be very difficult for you to try to not to focus your attention on this light. But if through acoustic simulation during the night, we achieve to transform this light into a small candle that is in the corner of the room, then the training for attention, for example, is much easier to perform in this situation than in the previous one. So again, we are really excited about the launching of this new tool because we believe that it's going to be very useful, not only for the patients, also for the therapists in order to know how to perform the different stages of the therapy.
Excellent. Thank you, Daniel, and thank you, Dr. Kasten. So just as a final slide, just want to thank everyone for their attendance. Before I open it up for some Q&A with our presenters here today, wanted to provide you my contact information if you have any questions about my Levo or would like to schedule a demo on the device itself, or any questions that I could help assist with, please reach out. Happy to assist and get started with your clinic with incorporating it into an option for your tinnitus patients. With that, I will go ahead and open up the Q&A session, and if you do have a question, please submit that on the Q&A tab in the Zoom link. One question here I have is are the patients responsible for purchasing the iPad and or earbuds? So orders are through prosthetics. Patients receive the iPod Touch and earbuds through the PO that's received. And then that is provided for them and sent directly to your VA office. Another question on my Levo, is it free? Yes, it is included in for all Levo patients. I can provide you the link to the URL, so please just reach out, and happy to provide that for future patients going forward. Next question about returning their iPod after 9 months, if they've received good benefit, or do they keep it in case they need to use it again? So Amber, maybe if you can touch on that, maybe patients that have finished therapy, what's your direction for those after the initial 9 months of therapy?
Yeah, so just like with hearing aids, if we buy them something, that's theirs to keep. I'm not asking them to give it back to me. But if you remember what Daniel said earlier, if they have an event, that causes their tinnitus to flare up again, they can use that to, reduce that again over time. They probably won't be using that, super consistently, maybe, 3 or 4 days afterwards. And then once that tinnitus goes back down, they can stop using it again. But yeah, I would have them keep that for sure so that they have that available to them.
Excellent.
And I even have patients who report that, it wasn't helpful for them, that they want to return it. I ask them to keep it as well, because, you never know if it might help them in the future. So they might try other things and realize that, I actually do want to try to be consistent with that and go forward with it. Because I've had them where I've had patients return it and then they ask for me to reorder it again. And it's just, I'd rather them just keep it and try to use it again in the future.
There's also a question here about how long do the results last? And this is a very interesting question, because when we started using the system in 2001, 2002, we had the same question. Were those changes that we were achieving permanent, or once we end the stimulation, the tinnitus flares up again? And we were very happy to notice that what we do here is to change the organization of the whole net, or the whole auditory pathway, the balance between excitation and inhibition in different levels of the auditory pathway. And then when we achieve a decrease of intensity, for example, if a patient started the therapy with 60 dBs in his tinnitus, and then he achieves 12 dBs of reductions, and he goes to 48 dBs, when he's set in 48 dBs and we made the detachment process, after that, he stays there. And he may have any punctual decompensation. As I said previously, he goes to a party or he drinks too much one night and the other day the tinnitus flares up. If he performs the stimulation for only 1 or 2 days, then he gets back to this new level that is 48 dBs. So for us, it was a very, we were very happy to notice that we were making changes that endure during time.
Thanks, Daniel. Amber, one question about what your formal tinnitus assessment looks like prior to Levo fitting. Do you do formal tinnitus assessments? What kind of diagnostics do you take for each patient?
We don't require we don't require that they have a tinnitus assessment. We do perform them. So we do things like tinnitus matching, um, uh, pitch matching, loudness matching, and we check to see if they have residual inhibition as well. So it's not required. Like we don't force the providers to do that for every patient they put through PTM, but some of them do, and that information is helpful. It makes the fitting a little bit easier. We know we have a much better idea of where we want the pitch match to be. But we've also had some people who do a pitch matching on their tinnitus assessment, and then they come in and they want something totally different. So it can be helpful, but also sometimes it's just, information on the side because they want something different at the time.
Sure. One question came up about the return period. So there is a return period with the Levo system. It is 90 days from the start of fitting. If the patient is not receiving benefit from Levo, there is an option to return at a zero restocking fee. So any questions, please, again, reach out to me and I can go into more details on that. So one last time, I'm going to share my information. And so again, please either call my cell or email, or you can scan the QR code, schedule a demo to reach out and continue this conversation. But with that, I'd like to again formally thank both Dr. Kasten and Drexler for attending. Thank you for sharing all of your tidbits and got a lot out of this webinar, and I really appreciate the time and thank you guys again. And with that, I hope you guys have a great rest of your day and week, and we will be talking soon. Take care, everybody.